we already did some significant number of presentations, but the most recent one were focusing on three topics. The first one was focusing on the receptor. And what we have shown over the past few years, we did a number of analyses from biopsies from different patients. We have assessed now more than 2,000 patient biopsy or patient's tumor. And we're showing that the SORT1 receptor, the sortilin receptor, is significantly expressed in a large number of solid tumors. The one thing which is very interesting is that for a number of those tumors like ovarian cancer, TNBC, endometrial cancer, thyroid cancer, this receptor is overexpressed in 80 to 90% of patients with those tumors, which is very, very significant, not only in terms of the percentage of patients, but also the expression and the significance of the expression is highly expressed. In other tumor types, as an example, where it's like the expression is a bit lower, would be like pancreatic cancer. But we still can see that there's about 10% of the pancreatic cancer that significantly express that receptor. Then that is indicating to us that we should focus our clinical development in tumor types that are significant expressor of the receptor, but eventually also that drug could also be useful for patients where the expression is lower but still significant in about 10% of patients. The other poster that we had three posters at the AACR. Then the second poster was focusing, it's an animal model looking at HER2, HER2 positive breast cancer. And what we have shown is we have shown very good efficacy with TH1902. It's an animal model, and this is similar to what we have shown in prior animal model. The one thing which is very interesting with our PDC is when we stop treating the animal, very often with standard therapy, there's a regrowth of the tumor. But when we stop with TH1902, there's really a lasting effect. And in that study, we went up to 140 days without relapse of the cancer in the animal model, which is quite interesting. And we think it's probably related to the fact that what we had shown before, it could be linked to the fact that we are bypassing mechanism of resistance like MDR1, that we are also very effective against vasculogenic mimicry cells. And we also have shown efficacy in cancer, stem cell cancer, that we show very good efficacy. Then all of this could explain the lasting effect. And the one thing which was interesting is we compared it to the combination of docetaxel and Herceptin. Herceptin is the gold standard to treat HER2 positive breast cancer. And as a single agent in that model, we were more like we had better efficacy than that combination. And the last poster is something which is very, very interesting, something that we weren't expecting. We did a study, and usually when we do study in animal, in mice, we take mice without the immune system and put a human tumor. But there are syngeneic mice model where you use a normal mice with tumor, mice tumor. And there's one mice tumor which is a cold tumor model, meaning that there's no infiltration of immune cells, and immunotherapy does not work in that model. Then we've treated those mice with TH1902, and we did a biopsy at the end of the treatment. And what we have shown is that there's TH1902 is inducing a significant infiltration of tumor lymphocytes. The immune cells are getting inside those tumors. Considering that this is a cold tumor model, it is very interesting and very significant in terms of results. That was the first step. And as a second step, after seeing those results, we did a study in combination of TH1902 and PD-L1. Then when we give only the anti-PD-L1 to the animal, there's no efficacy because it's a cold tumor model. If we give TH1902 as a single agent, we have a very good efficacy. But when we give, in addition of PD-L1, TH1902 as a synergistic activity with the PD-L1 inhibitor, then that's something that could lead to very, very interesting development in human. PD-L1 and immune therapy is working only in a percentage of patients. Then if we can turn some of those cold tumor into hot tumor, that could open the door to a much broader market for PD-L1 in combination with TH1902. Those three posters that were very well attended, and for once, very often during those meetings, the presenter had to be at the poster session only for an hour. Now they were open for 3.5 hours, and the traffic was tremendous during the answer time during the 3 hours. We had many people coming. It looks like there's a lot of interest from different companies with immunotherapy, companies without immunotherapies, looking at this technology, and the interest is really growing. The fact that it is a PDC, it's different than the ADC. The ADC have been successful, but now there's way more attention getting into the PDC. They're smaller molecules. We know that the ADC do not go everywhere in the tumor, in the microenvironment. We think that we have better chance with a PDC to probably show also very good efficacy in a number of different tumor models.